I have mentioned, yung outline natin, part 1 is more on the introduction. So guys, ito ay very shallow lang ito actually. We will not go into details na, no. So part 1 is the introduction of autopsy, and part 2 is another introduction of autopsy. Pero dito sa part na to, ito yung mga the conduct of autopsy na paano yung mag-cut ng mga specimens, etc. Alright? So to start off, let me share you this one, no? To the living we owe respect, to the dead we owe only the truth. Voltaire. Wala lang, nakita ko lang dyan sa gilid na parang feel ko lang i-share. Alright? Sige. Okay, actually this lecture is more on parang interactive ba siya kasi may series of questions I'm going to ask, no, in between. Okay, and the first question is, all of the following are the importance of autopsy except confirmation of identity, provision of allograft tissues for transplantation, identification of diseases with genetic components, none of the above, all of the above. What do you think is the answer?
None of the above.
All right, very good. So none of the above. Actually, hindi ko makikita kung sino nagsagot doon. So very good. Very good, Michelle. Okay. Next. Okay. So what is autopsy? Autopsy is derived from the words, no, autos and opsis. Autos, which means oneself, and opsis, which means sight or to view. So ibig sabihin, it is to see for oneself. And it's also known as excuse me po. It is also known as necropsy or postmortem examination. Ibig sabihin, kasi antemortem before death and postmortem after death or after, yun, pagkatapos siyang mamatay. So dapat the patient or yung tao na yan must be dead before we are going to examine, before we're going to nahiwain siya, no? So it is a systematic examination of a dead person for medical, legal, and or scientific purposes. So example, kasi we have two types of autopsy. Later I'm going to discuss. So there are, naka-record ba to? Na-record ito, no? Tama ba? All right.
Yes, no.
Okay, sige. So it is an ultimate medical consultation because from the start the patient, for example, in a hospital, from the start na admit siya kasi kailangan yung history, yung course in the ward niya until sa demise ng patient, doon natin makikita kung ano nangyari sa kanya by histologic diagnosis. And that means that autopsy is the ultimate medical consultation. All right, and remember that as future medical technologies, no, part of the paramedical fields, it is actually part sa ating part of our responsibility to tell to the family or the bereaved family of the benefits of autopsy. Remember that during our internship, sana yung during pre-pandemic, no, meron kaming cases na magre-release ng patay. So sometimes yung mga staff busy, tapos yung intern na lang magre-release ng patay. So yung iba mga arty-arty lang ba, takot ako, mga ganun-ganon ba, pero kache-chean lang ba yun? Okay? So sana ma-experience nyo yan sana, no? So sana walang pandemic para mas masaya ba? Hindi ko lang alam kasi baka in your time baka you can have fun naman while having di ba? Sa inyong duty in the future, no? So the first is the value to families. So it will provide families with the best possible understanding of why the death occurred. So ito yung mga cases natin na hindi alam ng pasyente o hindi alam ng family kung paano namatay yung pasyente. Okay? So guys, sa atin, no, yung mga jowa dyan, paano kayo naghiwalay, so gusto niyo ng closure. So just like in these cases, no, kailangan ng autopsy para malaman natin kung ano yung pinagmulan ng inyong hiwalayan or pinagmulan ng kamatayan ng pasyente, no? Next is the identification of diseases with genetic components. For example, itong mga Marfan syndrome. So, okay, kasi malalaman natin na meron siyang Marfan syndrome kasi usually meron tayong arachnodactyly, as we have discussed, no, si Michael Phelps daw or si Abraham Lincoln. Okay, meron daw silang Marfanoid yung habitus nila, so they are known to have Marfan syndrome daw. So the problem with Marfan syndrome is yung fibrillin gene natin, di ba? So may problema sa connective tissue natin. In that sense, yung aorta natin, weak yung aorta natin, there is prone to rupture, no, or dissection of the aorta. So in that cases, prone talaga yung pasyente magkaroon. So, kaya pwede nating masabihan yung family, ma'am, huwag na po kayong mag-anak. Okay? Huwag ka na yung magpadami ng anak kasi may problema tayo sa genes talaga. Hindi natin ito ano tawag ito? Hindi siya ma-prevent. Okay? Ma-prevent lang siya unless wala ka ng offsprings. Alright? Provision of factual basis for counseling relatives, as I have mentioned, yung mga ganun, no? And provision of opportunities to act altruistically by donating organs or tissue for transplantation, research, and or education. Remember yung mga yung driver's license, di ba? Willing to donate mga organs na ganyan, etc., etc. Of course, kailangan yung autopsy yan. Kailangan may patay tayo before tayo mag-harvest ng mga tissues, alright? Next is value to hospitals and clinicians. So provision of an accurate cause of death and characterization of pathology present are essential components of clinical audit. Remember, in a hospital, sa inyo, no, kung mag-proceed kayo further in training or further in education, kung mag-medicine kayo, pag nag-residency training, meron tayong mga tinatawag na clinical audit in which a case is presented to panel of different specialists. So merong pathologists, merong surgeons, merong clinicians, etc. Yun, tatanungin lahat, ano nangyari sa pasyente, sino nagkamali. Usually, ito yung mga nagka-clash ba yung mga clinicians sa surgeon, mali yan ng ganyan, mali ng... While yung sa pathology naman sa amin, silent lang kami kasi we have the last say, no? Kasi kami nakakaalam kung ano talaga yung cause ng death. Okay, so ito yung value ng autopsy natin, no? Contribution to characterization of poorly understood diseases and possible adverse events. So ito yung mga ano tawag dito natin dito. Ito yung mga nasa kay Jessica Soho, no? KMJS, mga di umano. Okay? Ito yung mga nabalita niya na nawawalan ng panty, ganun. mga wala lang, okay? Para may mabalita ba? Kasi siyempre yung mga chismosa, gusto yung mga ganyan, mga kakaibang mga istorya, di ba? May mga kataw. Natatawa lang ako, okay? Evaluation of new medical therapies and new surgical techniques and procedures. Remember, whether we like it or not, ano talaga tayo? Ano tawag dito? Nag-experiment talaga tayo. Kasi before a drug or a medical intervention is being sold or being introduced to the market, kailangan yun may series of tests. May series of tests yan, okay? For example, sa animal, sa tao na walang sakit, sa tao na may sakit, ganon. So, in the sense, guinea pigs talaga tayo. Kaya, pag-evaluate natin ng medical therapist, kailangan yung autopsy para malaman natin, ay, ito yung cause ito ng intervention na ito, cause ito ng surgical procedure na ito. So, by autopsy, we can evaluate medical therapies or surgical techniques which are effective or not. Next is value of administration of justice. So comparison of objective medical evidence with the apparent circumstances of death and confirmation or establishment of identity. Remember Yolanda, 'di ba? May mga ino-autopsy doon ng mga pasyente natin. And remember, in-autopsy sila for the establishment of the identity of the persons. Kasi usually hindi na yan, naagnas na yun. Alright? So, yun yung value ng autopsy natin para malaman natin yung identity ng tao. Kasi may mga dental records, okay, kung female or male ba yung skeleton, for example. But we will not go into details about that, no? Next is value to patients. Of course, may value din sa patients. It can provide allograft tissue for transplantation, heart valves, corneas, skeleton-related tissue, integument. Okay, so for example, may sunog yung mukha mo, alright? Tapos kailangan mo ng tissue for transplantation. Tapos wala ka ng ibang ano ba? Kasi ayaw mo ng may peklat ka sa katawan mo. So yung cadaver yung ano mo. So kinuha na ng skin sa buli tapos gintapal sa imong nga guya. So meron ka ng cute nga face, okay? Meron ka ng baby face, alright? So next is number 5, the value to public health and medical education. Of course, it can provide an accurate cause of death for statistics. Remember class that yung death certificate natin is very important because natatali ito sa sistema natin, no? So that meron tayong mga top, for example, mga top causes of death, for example. Kasi doon mag-base ang government natin on how they could provide programs to prevent these kinds of death. Okay? So important yung autopsy natin. Investigation of death of vulnerable individuals dying behind closed doors. So somehow ito yung sa justice, no, sa mga prison, sa mga mental institutions. All right, and as an early warning system in issues of public health and safety, and therefore contributing to the prevention of these disease and accidents. Di ba nakikita natin usually sa mga sa EDSA, for example, bawal tumawid dito, nakamamatay, okay? Tapos basta may nakita ko na bawal tumawid dito, may namatay na dito, all right? Baka in the future bawal tumawid dito, papatayin kita para wala na bang may na agad, may laser na agad sa ulo para wala nang pasaway ba. Okay? So, next question is, a 92-year-old female with significant cardiac disease falls down her steps, suffers a hip fracture while convalescing in the hospital. Ibig sabihin, nagre-recuperate siya. She dies subsequently 3 days after her accident. Which type of autopsy is not applicable? Is it clinical autopsy, hospital autopsy, medical legal autopsy, academic autopsy, or all of the above? Who can answer? Don't worry, I cannot see your name. And it's okay kung mali or any answer will do. What do you think is the answer here? The correct answer here is letter C. All right, because A, B, and D are the same. So C is iba. All right, this is forensic autopsy. Remember guys, pag may mga questions tayo, for example, no, not just in the exams, also in the board exam, pag hindi nyo alam yung sagot, anong sinasagot nyo usually? Anong letter? Talaga, sa totoo lang, anong sinasagot nyo talaga kung hindi nyo alam? Letter, anong sinasagot nyo?
C is always correct.
Oh, okay. So letter C daw kasi always correct, tama? Oo, sabi nila C daw kasi C for Christ daw. Char. Okay, C for char. Pero pwede din naman ang wag na wag niyong sagutin daw is letter D. Okay? Kasi demonyo daw. Or pwede din kung gusto mo social devil. Okay, pero the correct answer here is letter C. Joke yarn. Okay, sige. So, here are the types of autopsy. We have two types. We have the clinical autopsy and the forensic autopsy. So, clinical autopsy, as I've mentioned from our previous question, this is also known as hospital autopsy, academic autopsy. Why? Because it is usually done in the clinical setting, in the hospital. All right? Kaya academic because everyone is learning from the case. All right? And remember that it is done to determine the anong COD. COD is the cause of death. Okay? Cause of death in natural deaths. So anong ibig sabihin ng natural deaths? Ibig sabihin, during the course of the merong disease process, all right? Ibig sabihin nagkasakit siya or tumanda sa degenerative processes, etc. Yun, ganun yung natural deaths. Kasi meron tayong unnatural deaths. Later we're going to discuss that. And usually clinical autopsy are done by only pathologists or forensic pathologists. So magkaiba siya sa forensic autopsy or forensic autopsy or medical legal autopsy. Okay, so it is done when the cause of death is uncertain in cases of unnatural deaths. So ano yung mga unnatural deaths natin? Of course, these are deaths that are not natural. Okay, so for example, aksidente, pinatay, suicide, etc. All right. And usually, this can be done by a doctor, okay? By a doctor who trained in forensic science, not necessarily na nag-undergo kind of training ng pathology residency, but this can also be done by pathologists and forensic pathologists, all right? Ito lang yung pwede, yung doktor, no? Pwedeng any doctor can do it, okay? Basta nag-train siya sa forensic science for quite some time. So next question is, a 54-year-old male drug addict was admitted due to a ruptured abdominal aortic aneurysm and was scheduled for aneurysmal repair. The patient eventually dies after 15 days for hospital-acquired pneumonia. Which type of autopsy is applicable? Is forensic, medical legal autopsy, clinical autopsy, all of these, none of these? What do you think is the answer? Okay, so is this a natural death or unnatural death? Ruptured abdominal aortic aneurysm. So this is a disease process, right? So pag disease process, as I have mentioned, or natural cause of death, of course, this is clinical autopsy. Kasi itong forensic tsaka medical or medical legal, these are a natural cause of death. Right? Or okay, next. A fire broke in the printing section where the licensure examination sheets are printed, claiming the lives of around 10 people. Which type of autopsy is applicable? What do you think? Hospital, clinical, academic, all, or none of the above? Okay, what do you think is the answer?
None of the above, Doc.
Alright. Alright. None of the above kasi a natural cause of death, nasunog sila or namatay sila due to an accident. Okay? So the rest kasi these are one and the same. Alright? So very good. So next we are going to discuss about the definitions of death. So remember that the cause of death, the disease or injury that sets in motion the physiologic train of events culminating in cerebral and cardiac electrical silence. So ito yung mag-start or ito yung kumbaga parang domino effect. Okay? From the start of the injury up to the death of the patient. Usually it is referred to as the mechanism of death by your clinicians. So for example, ang question natin, which cause of death signifies the disease or injury which initiated the events leading to the death? Okay, from the question, no, signifies the disease or injury which initiated the events leading to the death. So sometimes kasi yung mga examiner, no, medyo ano yan sila, initiated, lagay natin initiating. Ay, parang kung ikaw naman sa ano, ayan, initiating, letter D. Tapos pagbasa mo, may leading din. Malamang wala na yan sila. So letter ABC na lang, di ba? Pero sinabi natin sa cause of death signifies a disease or injury which initiated. Ibig sabihin siya nagsimula talaga. Okay? So the correct answer is, what do you think is yung nagsimula talaga is yung underlying cause. The correct answer is letter C. Okay, so the causes of death are of three types, no? We have the immediate cause, antecedent cause, and the underlying cause. When we say immediate cause, of course, immediate, okay? The most recent or the final condition resulting in death. So, for example, hypovolemic siya, for example, ganon. So, later I'm going to show you, to give you an example, no? Next is your antecedent cause. Ito yung gitna, no, ng immediate cause at ng underlying cause. So, ito yung intervening cause of death occurring between the following, no, immediate and underlying. While your underlying cause, of course, ito yung pinakapunot dulo ng lahat, no? This is the disease or injury which initiated the events. Okay, and remember, this is the most important entry in that certificate because this is the one that is being recorded in your statistics. All right. So, for example, we have a case, no? A female driver went out of her car and performed the Kiki challenge. Parang sobrang tagal na tong Kiki challenge, no? Ngayon ano na ba yung challenge kaya pash-pash? Pash-pash. Di ba? Ganun na ngayon. Okay? Okay, performed the Kiki challenge along EDSA when she was hit by another car. She sustained multiple fractures and was dead on arrival at a nearby hospital due to the massive bleeding. So what do you think is the immediate cause? Okay, who can tell me the immediate cause ng death niya? Ito yung pinaka-recent, ito yung pinaka-final. Usually makikita mo din dito sa case natin. Okay, ito. Alright, the massive bleeding or the hypovolemic shock. Okay, so massive bleeding, wala na siyang dugo. Okay, wala nang magpapump o wala nang mapupunta sa mga vital organs mo sa brain. Alright, kaya siya namatay. So that is the most recent and the most final cause of death. While your antecedent cause, of course, yung antecedent cause mo, itong multiple fractures. Of course, nagkabali-bali ang buto mo. So nagka-lacerate yung mga blood vessels mo dyan, kaya ka nag-cause ng massive bleeding. While the underlying cause, ito yung underlying cause natin. What do you think initiated the events? Who can answer what is the underlying cause of this case? Manukso ko bala? Sige na, anyone can answer. Si ano ba? Si Oscar. Ay, sorry. Siya kasi yung sa una eh. Okay? Sige, Oscar, what do you think is the underlying cause here?
Good evening, Doc. I
Uh-oh.
think the underlying cause, Doc, is when the driver was hit by another car.
Okay, very good. Correct. Pero ang mas tama is Kiki challenge. No, hit by a car. That is the correct answer. Okay, very good. So next we go to the manner of death. So ano yung manner of death? The manner of death will tell us how the injury or disease leads to death. So for example, itong patatas, no? Pinatay siya ng isang patata. Okay. So next question is, a 59-year-old pole dancer died after falling from a 7-foot height attempting her signature death-defying stunt. Baw si Lola, may signature death-defying stunt. Her husband wants to investigate on the circumstances surrounding her death. Which of the following is not the manner of death in this case? Okay, what do you think is the answer?
A,
So
Doc.
letter A, very
A.
good. Very good, because this is caused by disease, usually yung natural cause of death, no? O pwede din, actually medyo tricky itong case kasi pwede din siyang pwede din siyang accident or pwede din siyang suicide. For example, ayaw na niyang mabuhay, so gusto na niyang nilagyan. For example, pwede din murder. Okay, minurder siya ng husband niya, nilagyan ng oil yung pole, okay? Or aksidente talaga. All right? So having said that, no, we have two types of, or the manner of deaths are of two types. Now we have the natural and the unnatural, as I have mentioned earlier. So natural death or natural cause of death is usually caused by disease or degenerative processes. While you're unnatural, ito yung mga hindi natural. Okay, namatay ka lang, secondary to accidents, suicides, homicides, yan, or undetermined. So pag sinabi nating accidents, of course, ito yung harm inflicted is unintentional. So hindi ko sinasadya. For example, may classmate ka nga pero may perfect, no? Tapos natuslok mo siya sang ballpen. Ay, sorry, hindi ko sinasadya, pero sinadya ko pala. Okay, pag sinabing suicide, this is inflicted, is intentional by yourself. So bawal wag nyong gawin ito, ha? All right? At lalong ito na yung homicide. So death at the hands of another person with motive to cause harm. While in cases na hindi talaga malaman, no, this is undetermined. So cannot be determined. So pwede ka nang magpaluy-aluy. Okay. Yung sa mga mga pelikula na sinauna, 'di ba? Yung mga kandila-kandila, mga form ng tao na pwede ka kadto to. Alright, hindi, joke lang. Okay, so these are some of the common natural diseases and their possible violent antecedents. So remember, very passing lang, no? I'm just going to show you, for example, itong meningitis, no? So nagkaroon ka ng meningitis, cerebral process. So remember, disease, di ba? This is a natural manner of death. Pero pwede siyang magiging unnatural. For example, binugbog ka, okay? Fracture of the skull, or jaw facial bones, or iatrogenic infection. So sa hospital, no, during procedure, hindi nagugas yung doctor, for example. Tapos nag-cause ka ng infection. Alright? And ito kasi yung sinasabi natin na pwede siyang mag-combine ba, kaya kailangan ng autopsy talaga natin. So akala natin that this is a disease process, but however, there's an underlying injury which might be unnatural. Alright? Yan, mga blunt impact to the head, for example. Okay, pneumothorax, traumatic intubation, for example, yung doktor, yung PGI, postgraduate intern or medical intern or junior intern, no, na inis siya siguro sa pasyente kasi yung relative niya sagay follow up ng mga lit count, all right, na inis ka. So intubate mo siya, traumatic, no, na pwede siya namatay. So inflicted yun, no, pero ang cause niyan is natural, alright? This just to show you na kailangan talaga ng autopsy cases or autopsy procedure on these cases. Okay, yung crib death, accidental or pwedeng homicidal suffocation. So 'di ba itong may mga kwento na nanganak yung mag-asawa. Okay, nanganak yung mag-asawa tapos laway ba ang bata? 'Di ba may mga bata talaga na cute, may mga bata man nga hindi man sa nalaway gid siya, no? Pagkakita, 'di ba usually yung bata cute man kanaming kusion sa guya, pero may iba niya nga kalaway gid bala. Pero lang joke lang yun pero sa totoo lang, real talk may ara talaga ganun. So itong case na ito, may ara naman itong case na ito, parang ganun siya, no? Hindi siya medyo cute yung baby, pero syempre sa panulukan sang nanay ang pinakagwapo nga bata. So yung anak niya, ang gwapo-gwapo sang anak natin, sige ibaon natin sa lupa. Eh, okay. This is an old joke na sa text pa ata yun eh. All right, next we go to the phases and stages of death. So what stage of death marks the cessation of the function of three systems, the nervous, cardiovascular, and respiratory system? What do you think? Letter A, somatic death, legal death, clinical death, all of the above, or none of the above? The correct answer here is letter D. Okay, all of the above. Same and parehas yan sila. Pag sinabi kasi nating phases of death, meron tayong ano yan, mahirap kasi to exactly pinpoint kung namatay yung isa, okay? Kasi remember that death is hindi man siya instant event, it's a process, no? Meron tayong 'di ba sa mga telenovela, kung nakakita ka mo sa telenovela sa isang basta Indian movie, sa Facebook ko lang ito nakita na nasa tricycle sila tapos nabaril natirohan sa ulo yung bayi, tapos na sa ulo gid na sa kamgid sa ulo, as in sa forehead ha. Tapos tapos nag-ano pa buhi Japon na parang naga-Indian ba Indiano, AS para appel, BS para bell. Maganon-ganon pa sa hasta dugay-dugay siguro 1 hour. 1 hour pa siya before siya namatay, o di ba? Ganon din sa Pilipino ng mga telenovela na bantayan mo si Junjun kasi ganyan, pag-aralin mo anak ko, tapos bigla may buntong hininga. So, yun yung pinapakita that there are phases or stages of death. Hindi siya in an instant, pag namatay ka, patay ka. Alright? So, here are the phases or stages of death. We have somatic death and molecular death. When we say somatic death, somatic body, alright? So, this is also known as clinical, systemic, or legal death. And remember, cessation of the function of the three systems, brain, heart, and lungs. So ito yung mga importante, okay, the vital organs na kailangan natin malaman. Okay. Okay, ito yung parts ng brain, parts ng body, vital organs that are needed. Kailangan na wala muna siya or nagtapos na or nag-stop na yung function niya before we can legally say that the patient is already dead. So death of organism as a whole, kasi nga bodily, all right? While your molecular death, also known as the cellular death, so at the cellular level, no? Kasi remember, patay na nga yung organs mo, pero meron pa din mga individual cells na nagkikahos or naghihingalo, no? Pero eventually, mamamatay din sila in the near future kasi wala nang oxygen talaga sa katawan. All right, and this is complete in 3 to 4 hours after somatic death. So remember, somatic death mas mauna siya kaysa sa molecular death, and in around 3 to 4 hours pa. All right, kasi nga meron pa din mga substrate sa katawan natin na nandun pa din sa blood vessels, no? Until maubos yung mga substrate or until maubos yung mga nutrients doon, patay na siya. All right? Wait lang class ha, kasi may nagre-refer lang. Sorry lang gid. May nagre-refer sa mole. Dahil lang gid ha. Wait lang gid. Sorry ha. Dahil lang gid ha.
The subscriber cannot be reached.
Okay.
Please try again later.
Okay, sige. So next is your, which of the following postmortem changes is considered as an early change? Okay. So what do you think is an early change? We have the cessation of respiration, cessation of circulation, rigor mortis, putrefaction, formation. So guys, the correct answer here is letter C, rigor mortis, because cessation of respiration and cessation of circulation, ito yung mga immediate changes, okay, postmortem changes. All right, so yung mga postmortem changes natin, of course, these are the changes that cause bodily effects, no, after death. All right, wait lang din guys. Okay, so postmortem changes according to temporal pattern, we have three, no? We have immediate, as I have mentioned earlier, early and late. Pag sinabi tayong immediate, of course, ito yung mga vital organs functions na nag-stop, okay? Cessation of vital organs. So kumbaga, ito yung ano natin, somatic death, right? Okay? It occurs minutes to hours, occurs simultaneously with clinical death or somatic death because there is loss of vital organs or vital functions ng vital organs natin, brain, heart, and lungs. While yung early natin, so hours to days, although it can overlap din naman, no? So in the early postmortem changes include all of the following mga mortis natin. Later we're going to discuss lahat ng mga mortis na yan. While you're late, okay, days to years, we have putrefaction, adiposire, mummification, skeletonization, right? So a positive Winslow test which indicates cessation of respiration. So what do you think is the correct answer here? No dimness of mirror when put near the nostrils, no movement of feather when put near the nostrils, no movement of water in the chest or abdomen, no respiratory sounds, none of the above. The correct answer here, as you have mentioned earlier, C is the correct answer. Letter C, all right? Correct answer is letter C. Okay, so test for cessation of respiration. So ito yung mga test na kung paano natin malaman kung nag-stop na yung respiration. Some of these tests are actually historical, no? But for the sake of learning na lang, no? May discuss natin sila briefly. So first is your auscultation. Of course, auscultation, ginagamit natin yung stethoscope, okay? So syempre, kung walang breath sounds, kung walang marinig sa stethoscope na wala ng hangin, okay, marinig mo man siya parang ganon, okay? Basta breath sounds. Pag walang breath sounds, ibig sabihin, the patient is dead, all right? Or nag-stop yung cessation niya. So isang vital organ is dead, all right? While your mirror test, anong sa mirror test naman? Ang ginagamit dito sa mirror test, a mirror is placed in front of the mouth or nostrils ng patay. Kasi remember, 'di ba, yung mga yaya pag naglinis sila sa mga window, ano ginagawa nila, binubugahan nila ng mahalimuyak na hininga ang window, 'di ba? Parang may naga-moist, all right? So the same yung principle niyan, all right? Naga-hazy ang imong mirror or yung glass. So pag may nakita kayo ng patay, siguro ang nakadiscover nito, "Uy, may patay." Tingnan natin, kuha tayo ng mirror, ilagay natin yung mirror sa iyang bunganga or sa iyang nostrils. Pag nag-hazy yung pag nag-hazy yung mirror or may basa-basa yung mirror, ay buhay pa siya. Pag wala, patay. All right? Next is your feather test. Okay, kailangan natin ng mga sangkap ng ating pagluluto. Dapat meron tayong balahibo ng ibong adarna. Alright? Hindi, any feather daw, mga kabuangan man tong test, no? But for the sake of discussion, no, baka malay mo, lalabas sa exam, right? Yung feather test naman, the same thing, no? Ang ginagawa mo is that, yung feather, ilagay mo lang siya sa nostrils, okay? Pag pag walang movement, ibig sabihin walang hangin na lumalabas, okay? So tanong mo, paano pag may bagyo? Okay, buhay siya. Buhay yung patay kasi naggalaw ang mga feather. All right? So no movement of feather. And lastly, itong Winslow. Okay, sana yung pangalan parang medyo scientific, pero it's the same thing. But it is it is based on the movement of the abdomen. So anong ginagawa, no? Patay nakabulagta, no? Lalagyan mo isang glass or isang saucer of water. Okay? Ilagay mo siya sa chest or abdomen. Tapos titignan mo kung nagasaka panaog ang imong nga glass. Very good, no? 'Di ba? Very scientific talaga. Okay? Pag walang movement, patay, all right? So, of course, class, ito yung pinaka-reliable of all, no? Auscultation. Ito siguro wala na silang magawa. Sige, mag-discover tayo ng isang test. Alright? So, this is the auscultation method. Alright? And this is your, ano to? Hindi, buhay pa to siya, ha? Alright? So, this is the Winslow. Water. Alright? Oh, this one is the mirror test. Okay, merong dimness of the mirror or merong haziness, alright? And next is ayun, pwede din pala itikon mo na lang sa feather. Okay, pag nag-hatching yung patay, buhay siya, alright? Okay, pag nag-move yung feather, that's the patient or the person is alive. Okay, so we are done with the cessation of respiration. Now we go to the cessation of heart, okay, or cessation of circulation, alright? So question is, a positive diaphanous test which indicates cessation of circulation. So anong positive result daw ng diaphanous test? Okay, so the correct answer here is letter B, opaque or yellow webs of fingers. So we're going to discuss one by one. Again, just like your cessation of respiration, meron tayong mga test dito na historical, no? Mga kawalang saysay, walang saysay, no? First is the Magnus ligature test. Anong Magnus ligature test? So it consists of tying a ligature around the base of the finger. All right, sufficient enough to cut off the venous channels, including the vessel. So ano mangyayari? If the circulation is wala na, so natural, maglapsi siya, puti siya all throughout, no? White siya. Kasi wala na dugo na dumadaloy doon. Pero pag buhi siya, ano mangyayari? Meron kang bloodless zone, okay, sa around the ligature or around sa thigh, okay? Tapos yung edges no nagiging blue or swollen. So, ibig sabihin, meron kang blood flow, may arterial flow sa tip ng finger mo pero wala kang venous backflow or hindi naiipit yung venous circulation doon kaya nagbo-blue. All right? So ibig sabihin pag patay na, the finger remains white. How about yung fingernails? Just like the same, no? There is no blanching. Kasi pag blanching, pag ginpindot mo ang imong finger, okay, magpuputi siya, pero pag tanggal mo, mag-pink siya ulit. Ito sa fingernails, kasi wala na circulation, so walang blanching na mangyayari. Ito yung diaphanous natin. Ang diaphanous test natin, anong ginagawa nito? So, ang gawin mo lang is pag may nakita kang patay, kuha ka ng isang bright light o isang flashlight and you shine flashlight sa iyang kamot. Okay? Pag nakita mo ang webs ng fingers, okay, ang in between, 'di ba, ng mga fingers natin, yung parang webs, okay? Yung webs ng fingers natin, pag nakakita tayo ng pinkish, ibig sabihin may circulation diyan. Pag wala or opaque or yellow, ibig sabihin wala ng circulation dira. Pag tingin ko kagina sa akong kamot, daw wala man ko nakita pink. I see dead people. Yeah. All right. Next is your heat test. Ito, Diyos ko naman yung heat test. Anong ginagamit dito sa heat test? It's either you use a burning match or a melted wax. So anong ginagamit ginagawa dito, pasuon mo ang pasyente. Okay, kung buhay or hindi. Anong mangyayari pag heat test? Remember, yung heat is a form of injury, no? Pag totoong injury yan, if the patient is alive, anong mangyayari? There is erythema kasi may inflammation. There is a mechanism by which the body fights off the injury. All right? So yung may blister ka na may erythema around or gapula sa gilid, so that is a true blister. Pero yung patay, walang true blister. Ibig sabihin, may blister lang siya pero walang erythema or signs of inflammation. All right? Pero ang siguro dito, pwedeng modification dito, heat test, wala kang or nag-aray ang pasyente, so buhay siya. Alright? Next, ito pinakamadugo, pinakamasaklap, artery incision test. So anong gagawin mo to check for the kung patay or buhay ang pasyente? Kuha ka ng kutsilyo, tapos ang tawag dito? Magsiksi ka sang pulso. Okay? Anong mangyayari pag buhay? Pag buhay ang pasyente, syempre mag-aray kag mag-jerky movement of blood. Okay? So, wala na imagine ko lang, no? Kunwari, during those times, siguro yung ginagawa nila ganun. No? So, artery incision test, may nakita na kabulagta, tapos yung pala natulog lang, tapos check mo, gin-incise mo yung iyang artery sa kamot, paglaslas, nag-jerky movement ang dugo, ay buhay siya, tapos nawalan ka ng dugo, tapos dinala sa ospital, tapos namatay. Alright? So, no jerky flow of blood. Next is your ICARD fluorescein test. Anong ginagawa dito sa ICARD fluorescein test? Of course, we inject fluorescein dyes. Okay, of course, kung may circulation o kung gumagana yung circulation natin, kung buhay pa, of course, nadadala sa circulation ang dye natin. So, nako-color ang areas kung saan nag-flow yung blood. So, pag walang blood flow, of course, no discoloration after injection. And lastly is your second to the last, no, auscultation. Again, wala tayong heart sounds, pagpatay. And lastly, your ECG, flat for 5 minutes. Of course, yung ECG kasi ito yung electrical activity, ito yung mangyayari before ka magkaroon ng contraction of the heart. Okay? Kaya the most reliable here is the ECG talaga. Okay? So ito yung din sa mga telenovela, di ba? Nag-flat line tapos gin-defibrillate. Yung parang daw may flat iron, may plancha, baging plancha ang iyang chest. But mali yon kasi pag flat, supposedly, i-CPR mo siya. Okay? Ang defibrillation. So, tatanggalin mo yung arrhythmia lang. So, pag may nakita kang mga fibrillation, ventricular fibrillation, mga problema, may arrhythmia ka, that's the time nga, planchahon mo siya or defibrillate mo siya. Ganun yung use nun, hindi sa flatline. Okay? Pwede nating i-report si GMA or si ABS. Okay, so test for cessation of circulation. So this is an example of your Magnus ligature test. This is the blanching. So ito yung webs. Buhi pa to ha. Tingnan mo na pink lang siya. Wala ko kasi makita na webs. Ito yung webs natin ng finger, no? Ito siya ay pwede na siya maglangoy sa dagat, alright? So pwede ito sa KMJS, alright? So this one is the true blister as I have said, no? So buhi ito. Tingnan mo, ginpakita yung gani sa aton, no? So true blister kasi may inflammation, erythema, all right? Acute inflammation, right? So this is the incision test. This one, the ICARD fluorescein test. All right. Okay, so we move on to the other changes, no? Postmortem changes. So this is the dark red-brown stripe that develops horizontally across the eyes when the eyelids are not closed after death. So what do you think is the correct answer is? Here? The correct answer is here is letter A. You read this as tache noire. Okay? Pwede din tache noire. Okay. Para Japanese la tache noire. Tsaka pinamina. Alright? So, early postmortem changes. Tapos na tayo sa immediate postmortem changes. As I have mentioned earlier, these are the vital organs. Cessation of vital organ functions, right? Next is your early postmortem changes. So, we have eye changes. So, dilated, fixed pupil. So pag nakita mo, di ba, pag may patay usually kasi, pag nakita mo yung patay, usually hindi shiny yung mata niya. Parang opaque yung mata niya. Yun sa mga autopsy namin, yun talaga nakikita ko. Okay? Madumi ang iyang mata. Alright? Dilated, fixed pupils, loss of corneal and light reflex, and your tache noire. So, ano yan siya? So, it is actually a drying artifact that can mimic trauma. So, nag-dry kasi yung mata niya. Kaya may strip, no? Sa area na kung saan nagbukas ang imong mata. Okay? Ang natabunan sa eyelids mo, of course, wala dyang dark red-brown. So, this is due to the collapse of the vessels in the eyes. Alright? Or in the cornea natin. No, in the eyes. Next is your skin changes. We have pallor, ashy white, loss of skin elasticity, of course. And we have the primary muscular flaccidity. The jaw falls, eyelids lose tension, and joints are flexible after 3 to 6 hours after death. So, ito yung nafe-feel nyo siguro pag meron kayong activity na kailangan yung tapusin na tatlo, no? The jaw falls and the eyelids lose tension. Alright? Next is your contact flattening with pallor. So, anong nangyayari, no? The body part subjected to pressure due to loss of muscle tone after death becomes flattened, blanched, and pale. So, kung halimbawa nakahiga siya ng flat, okay? Nakahiga siya ng flat, of course, ang mga may contour dyan sa buli, ang likod, ang upper back. So, nagbablanch yun or nagputi kasi nga may pressure doon. So, kung saan nag-contact sa pressure, yun nagkakaroon ng pallor. So, this is an example of your tache noire, okay? So, ito yung sa area na hindi na close ang imong eyelids. O, tingnan mo, hindi siya shiny, no? Later, tingnan yung mata nyo ha, kung shiny or hindi. Pag hindi shiny, nako, magpa-prayer na tayo. Alright, so this is skin changes, the pallor of the skin, and this is the contact flattening pallor. Okay? Contact flattening with pallor. Okay? Ito yung mga na-contact sa surface, no? Kaya blanched siya. Kaya white siya, no? Okay, next. Sites where thermometer is placed to evaluate the temperature of the cadaver for estimation of algor mortis. Okay? So, anong correct answer dito? Is it the subhepatic area? Is it the vagina? Auditorium hiatus? Rectum? All of the above. Okay? The correct answer here is letter E. Actually, pwede yan sa lahat. Okay? Of course, pero yung ano talaga dito, may pinaka-appropriate dito is the subhepatic area. Okay? Kasi pag open mo ng isang cadaver o pag open mo ng isang rib cage, so makita mo yung liver, tupion mo lang siya tapos ilagay mo yung thermometer doon. Alright? Hindi naman sa vagina kasi base magising pa yung patay, ay medyo sa gilid-gilid pa. Alright? So hindi yan. Although pwede yan siya. Okay? Pero the most dito na pwede nating gawin is the subhepatic area. Alright? So don't worry, hindi ito lalabas sa exam, no? Hindi ito yung Cockcroft Gold formula. Alright? So what is algor mortis, by the way? So algor mortis is the process by which the body cools after death. Of course, 'di ba? Di ba mga saying na mas malamig pa sa bangkay, right? So this is algor mortis, all right? So this is due to the cessation of thermoregulation, and remember that during the first 6 hours after death, there's an average fall of temperature of around 1.5 degrees Celsius per hour. And in the next hour, around 0.9 to 1.2. And this is the Moritz formula, 37 degrees Celsius minus the rectal temperature divided by 83. Okay? So yun yung formula natin to check on the cause of death or the time since death, no? Malalaman natin kung kailan siya namatay. All right? So ito yung natin example. Okay. Layla was found lifeless in the battleground arena after Zilong stabbed. Bakit dalawa? Stabbed kasi, di ba? Pag mag-skill si Zilong, ang dami, no? So Zilong stabbed her from behind. Nana, her friend, took her rectal temperature out of curiosity and it read 32 degrees Celsius. So how many hours since the brutal death of Layla de Lima? Hindi, joke lang. Alright, so from the formula natin kanina, 37 minus rectal temperature over 0.83. So it is 6 hours before the death of Layla. Okay, so naubos na tanan nga Tourette, no? Yun, namatay siya, 6 hours. Alright, so next is, in which of the following conditions postmortem caloricity is seen? Massive abdominal hemorrhage, cyanide poisoning, carbon monoxide poisoning, septicemia, or all of the above. Okay, postmortem caloricity, ibig sabihin, hindi lang siya nag-cool yung body, but there are also areas or cases in which the body is actually, mainit. Okay, mainit. After death, meron siyang heat na napoproduce. Okay, the correct answer here is letter D, septicemia. Okay, secondary to the interleukins, all right? So ito yung mga causes natin ng postmortem caloricity, no? We have postmortem glycogenolysis. Of course, may mga substrate pa din kasi dyan, no? Okay, and tetanus and strychnine poisoning. Remember, pag sa tetanus, there is sustained muscle contraction. And remember that when there is muscle contraction, there is heat generation. And again, yun kanina, septicemia, bacteremia, infectious, due to the microbial products, no? And intense asphyxia condition, which can disrupt your thermoregulatory system in the brain. Okay, which of the following is considered a reliable sign of death? The correct answer here is letter B. Tandaan nyo, okay, livor mortis. Okay, what is livor mortis? Livor mortis is subcutaneous hypostasis postmortem lividity, postmortem staining, suggelation, or VBCs. And remember that it's fully developed in 6 to 8 hours and there is no blanching when pressed for more than 8 hours. Why is it a reliable sign of death? Because fully developed siya in 6 hours. So ibig sabihin, pag may pinatay ka, okay, for example lang pag may pinatay ka, pag naka-live lang siya dyan for quite some time, for around 6 to 8 hours, fully developed na siya. So, ibig sabihin, namatay siya ng ganyan or nandun siya mismo sa lugar. So, pag i-change mo yung position niya, hindi na yan magbabago yung livor mortis. Kaya, kung meron kayong, ang gagawin nyo, every 2 hours or every hour, balhin-balhinin mo yung patay para hindi malaman na namatay pala siya 6 to 8 hours ago. O, may na kayo, may idea na kayo. Alright? So remember that there are tardive spots. Ano yung mga tardive spots? These are petechiae or purpuric hemorrhages that develop in the areas of dependency. For example, doon sa area kung saan yung most dependent part. Alright? So ito yung mga tardive spots natin. So ito yung blanching din, no? So ito, nag-develop na siya in 6 to 8 hours. So namatay siya within those times or more than, no? Nakahiga lang siya. Alright? So the color postmortem lividity may suggest the cause of death. What is the most likely cause of death? If there is bronze-colored livor mortis. So bronze, ako sometimes kasi pag nag-aaral ako, medyo yung sounds like, okay, bronze-colored. Ano yung magkatunog dito? Carbon monoxide, cyanide poisoning, hypoxic states, perfringens infection, septic abortion. The correct answer is letter perfringens, bronze. Okay, gayahin nyo lang, alright? So cherry red, ano yung cherry red? Color ng livor mortis, ha? Alright? Cherry red, carbon monoxide, very important. Laging lumalabas sa exam, not just sa exam, sa board exam. Brick red, cyanide poisoning. Red-brown, nitrates. Dark brown, phosphate, chloride poisoning. Pag pink naman, of course, ito yung mga cold refrigerated bodies. While your grayish, brown, or black, these are your septic abortion or yung opiate poisoning. Your blue to purple, of course, ito yung mga congestive or hypoxic states kasi itong mga hypoxia, okay? Ibig sabihin, deoxygenated yung blood natin, alright? While your bronze, as from your question, bronze perfringens, alright? Black, brown, opiates or methemoglobinemia. So remember that one, ha? While your deep blue, aniline injection or aniline poisoning. However, the color is still dependent on the skin color. So yung mga African-American, di ba? Or cherry red ba to? Parang hindi man. Parang talong. Okay? Hindi mo din malalaman. So depende pa din yan sa complexion ng pasyente or ng cadaver. Right? So ito, ano ito? So tingnan mo, parang cherry red siya, no? So this is carbon monoxide poisoning. Ito, hindi naman siya cherry red. Pero medyo purplish siya. So this is in cases of hypoxic states. This one, hindi, kagigising lang siguro niya, no? May mga siri-siri pa. Ibig sabihin, mga ano niya siguro, mga kumot ba nga nagtupi-tupi. And this is a refrigerated body. Okay? So, malalaman mo kasi medyo madumi-dumi na. Ang iyang medyo may buling-buling pa. Alright? Okay, so tardive spots is associated with which? Postmortem change. So as I mentioned kanina, no? Rigor, livor, argor, pallor. Isa, dalawa. Parang yoyoy rebillame lang. So the correct answer here is letter livor mortis, the most reliable. Okay, si livor mortis. Okay, so parang tapos na tayo sa mortis, no? Ano pa yung next na mortis? Okay, si Edgar Mortis. Alright. Okay, alam niyo ba siya kung sino siya? Sa Gawin Bulilit yan na director. Alright. Sige. Isa pa nga. Alright. Sige. Okay, which of the following body parts usually stiffen the last? So, ano yung body parts dito? Ang nagatig-a sa pinaka-last. Ang nagatig-a last. Alright? So, what do you think? The correct answer here is fingers and toes. Okay? So, regarding sa stiffening of the body, that is rigor mortis. So, anong rigor mortis? This is postmortem stiffening of the body muscles. Okay? And it occurs as ATP is depleted, preventing the relaxation of muscle fibers. So, pag wala kang ATP, ito kasing ATP, nagko-cause ng ng relaxation, okay? Ng relaxation of the muscle. So pag wala ka ng ATP, ADP na lang yan. So nakalock yan siya. So mangyayari is that there is stiffening or there is contraction of the muscle kung wala tayong ATP. Kaya matigas yung katawan. Remember, there is the rule of 12 in rigor mortis. So ano yung rule of 12? Fully developed in 12 hours, it persists for 12 hours and passes off in another 12 hours. So rule of 12. So tandaan nyo, as I mentioned, ako pang nag-aaral ako, parang ano siya sounds like, no? Rigor mortis, rule of 12. Okay? Rigor mortis, fully developed in 12 hours. 12 hours. Okay? So remember that one. And remember, ito yung mga the first and the last, okay? Una-una, parang gapaligo ka lang kung ito yung mga yung pattern kung saan una magtitigas at kung ano yung huli. Okay? Daw gapaligo ka lang. Of course, sa una, ang unang titigas is eyelids, parang gapaligo ka. So, syempre magtanggal ka anay isang imong muta. Okay? After nun, wash ka ng face, tapos sa neck and trunk, then extremities and legs, and yung legs, yung fingers and toes. So, the last to stiffen are the fingers and toes. All right? So, all cadaveric spasms, okay, all cadaveric spasms associated with cadaveric spasm are the following, except, no, caused by electrocution. Siguro guys, mag-ano na tayo, medyo bilisan na lang natin, no? Okay, the correct answer here is letter A, caused by electrocution. Except, no? Kasi all of these are cadaveric spasm. So cadaveric spasm, anong tawag dito? So this is the instantaneous spasm or cataleptic rigidity occurs at the time of death. Usually, ito yung muscles that are contracted habang buhi pa siya na naging stiff or rigid immediately after death na hindi na siya nag-cause ng primary relaxation. Usually, in cadaveric spasm, ito yung mga conditions na kung saan there is sudden death or there is excitement or merong fear, severe pain or exhaustion. So ito yung mga cases ng mga brutal, for example, murder, na may habulan pa sa kampo, okay? Meron ba exhaustion or merong pagpupuwersa, okay? Yun yung cadaveric spasm natin. All right? Your heat stiffening naman, burning, immersion in hot liquid, of course. Siyempre, kung ikaw ba naman ihawon ka, no, or iprituhon ka sa hot liquid or hot oil. Okay? Siyempre, magtigas ka, mag-crunchy. While your cold stiffening, of course, extremes in temperature, high and low temperature, of course, freezing. All right? Okay, so this one is your nasunog to. Okay? Okay, this is heat stiffening. This one is okay, this is Elsa. Okay, ano to? Freeze or cold stiffening. And this one is cadaveric spasm. So remember, meron pa siyang, there is struggle, no, prior to death. Okay? Oh, gaya nito, no? Medyo nagano pa siya siguro, this is a murder, naglagan-lagan pa siya sa kampo, no? So yun, may mga roots pa siya nakuha, so there is struggle prior to the death. So this is cadaveric spasm. All right? So, okay na yan. So, supravital reactions include the following. We have tendon reaction or Zachos phenomenon, whole muscle relaxation, while your idiomuscular reaction is your localized contraction of the muscle. Ito yung mga supravital reactions. Ito yung mga life-mimicking observable reactions due to external stimuli. Ito yung makikita natin na patay na pero parang nag-twitch pa ba? Ay, minumulto tayo. Pero these are just normal, alright? Pwedeng electrical excitability of skeletal muscle in which pag naglagay ka ng kuryente, pag kinuryente mo yung muscle, group of muscle, mag-move talaga yan siya. Or in pharmacological excitability of skeletal muscle or smooth muscle, no? There's modification of diameter of ophthalmic solution. So pag pinatak, di ba, mga surgery ng cataract, ginapa, dilate ang pupil para easier access yung lens natin. Alright? Okay, wag na ako mag-ano sa questions, ha. Late postmortem changes. Okay, so we have putrefaction, absolute sign of death, follows Casper's dictum. 1:2:8, air, water, soil. Ibig sabihin, mas matindi sa air or mas mabilis yung putrefaction sa sa soil. Alright? Ibig sabihin, mas matindi. 8 eh. Or 1:2:8. So, mas madami sa soil than water than air. Kasi sa soil, nandun yung mga bacteria natin. And we have maceration, greening, discoloration, marbling, skin slip. While your gases, we have hydrogen sulfide, ammonia, methane, carbon dioxide, extrusion of fluid or the purged fluid, which is very mabango. Okay? We have teeth fall out and maggots because, of course, may mga flies na naglilay eggs after death. Example, nasa soil lang siya. And also, we have attack of the rodents. Okay, so these are the decomposition changes observed. Pag sinabi natin bloating of facial features, it occurs around 36 to 48 hours. Of course, sa bloating, nandun yung mga blisters natin. While in 3 to 6 days, 2 to 3 days, skin sleep, changes in external genitalia, and bursting of abdomen secondary to the gas formation. Okay? So this one, so this is arborization of the greenish discoloration. Okay? Secondary to self-hemoglobin, all right? So there, this is marbling, no? Arborizing pattern due to the decomposition of blood na nakukuha niya yung pattern ng blood vessels natin. Of course, this is skin slip, okay, 48 to 72 hours. And this one is the blister, no? Yung purge fluid na pag pinutok mo, okay, malimuyak, no? And this one is your maceration. So remember that maceration is an autolytic postmortem process that occurs intrauterинely. So sa loob ng dinadala ng mother. And this is caused by an endogenous enzymes and not putrefactive bacteria. Kasi this one, yung kanina, mostly caused by your putrefactive bacteria. This one is not. This is caused by enzymatic breakdown. Okay? And remember yung postmortem changes natin, ano yung cause ng Clostridium welchii, yung bacteria natin, ha? Alright, nasaan na ba yun? Basta, Clostridium caused by Clostridium welchii. Alright? Yung pinaka-culprit natin ng late postmortem changes. So, ito yung mga period natin, no? Initial decay, early or green putrefaction, black putrefaction, butyric. Ito yung mga colors natin, yung green putrefaction due to self-hemoglobin, black sa hydrogen sulfide, butyric sa gaseous na ito, okay? Formation of gas, and eventually dry decay or skeletonization. All right, the last and final stage of decomposition is, of course, the last is your letter C, skeletonization. Skeletonization, okay? Acidification, syempre, social, hindi yan siya, okay? Gawa-gawa lang yan, right? So late postmortem changes, adipocere formation, ito yung sinabi ko, aside sa putrefactive bacteria nyo, ang adipocere formation is caused also by your Clostridium welchii, initiating hydrolysis and hydrogenation of body fats. So this is a saponification, or also known as the grave or mortuary wax. All right. Next is your mummification. Mummification is desiccation of the body and viscera after death. So ito yung mga, di ba, sa mga Egyptian, no? Dinedesicate ang body, dinedry yung body, no? Pero hindi pa to labas ang imo nga mga bones. Kasi the last mortem changes is your skeletonization, in which the soft tissues have decayed or dried to the point that the skeleton is exposed. Ano ito? So ito ay your adipocere formation. So the grave or mortuary wax, okay? The hydrolysis of fats, no? Secondary to Clostridium welchii. So this one is your okay? Mummification, all right? Nandun pa yung mga soft tissues mo. There is desiccation, extensive drying of the body, and eventually, pag sobrang tagal na, there is skeletonization, all right? So, na-expose na yung mga kalabira, all right? So, remember guys, pag may time kayo, tawagan nyo lang si Marlene, okay? Kailangan maniguro tayo, all right? So, these are, give me more 10 minutes, ha? Tapusin natin ito. All right, so we have preservation of the bodies, okay? We have the natural adipocere formation, mummification, skeletonization. Of course, yung mga natural natin. Siyempre, yung mga naipag-iwanan natin sa gilid. While your artificial, ito sa mga embalsamo natin, embalming, injecting certain fluids, fixatives into the dead body. And we also have chemical contents, formaldehyde solutions, arsenic, lead sulfide, potassium carbonate, and the usual sites are your femoral arteries and the neck and the aorta. Okay? The most common one used is your formaldehyde, of course. So ito yun sa femoral. Ay, sa femoral, sa neck. Okay? Sa jugular. All right. In case of death by burns, the watch of the victim was stopped at the exact time the burns due to intense heat. What is the method used in the estimation of time of death? The correct answer here is letter concurrence method. Okay, the concurrence method. So ano ba yung time since death? What is time since death? This is the postmortem interval. So the time between the death and the postmortem examination. So namatay siya tapos dinala sa hospital or sa any institution na kung saan i-examine, i-autopsy na siya. So the time frame in between is the time since death natin. So we have two types. We have the rate method. Of course, rate, pag sinabi natin rate, dahil sa changes produced by a process which takes place at a known rate. So merong halimbawa, mga mortis natin, no? For example, this occurs blank, blank, blank per hour. So there is a rate that is occurring in a rate method. While your concurrence method, ito yung buo, no? Evaluating the events which happen at or near the time of death or offer information suggesting a time or period for the death event. So ito yung you take into consideration lahat ng nangyari. So hindi siya yung rate method. So ibig sabihin yung concurrence natin, ito yung mga marites natin. Alright? So ang daming chismis, no? Nabalaan nilang, uy, mag-ano na siya, oh, medtech gali na iya nga bata. Nakita ko dyan, oh, na, hala, nagbusong naman to sa. Alright? Yun yung concurrence method, no? Yun na-evaluate yung tanan, no? Na hibalaan ni marites tanan niya mga ano mo. Tanan niya, ano mo. Tanan niya sikreto mo. Alright? So, ang time since death natin, so this one, nag-stop ang imong relo. Secondary, for example, may bullet, nag-stop na, ano yan, indicating the exact time of death, for example, no? And also, itong burns, okay, in which the watch was found and stopped at the exact time of burns due to intense heat. Siyempre, hindi natin din malaman kung may battery ba yon or gumana ba or time, sakto ba yung time niya. So, hindi pa din reliable. Yung reliable pa din is, yan, no? Reliable pa din is sila marites. Okay? So, the time since death, you give me the method, no? The rate of drying or discoloration of blood pools, of course, there is a certain fixed amount or ang tawag dito, may rate talaga of drying. Ibig sabihin, ito ay, syempre, rate, no? Okay? Rate, no? Rate method. Rigor mortis, livor mortis, algor mortis. Of course, rate pa din yan. Okay? Kasi there is a known rate in which the body cools, in which the body stiffens, okay? In which the body causes lividity. Alright? Time of last meal. Of course, concurrence yun. Okay? Kailan siya nagkaon? Nakita ko siya dyan sa ano, nagkaon siya sa ano, nagkaon siya sa gilid, Stopping of watch due to trauma or drowning or gunshot, of course, concurrence yan. Receipts and dated slips of paper in deceased pockets, syempre, si marites yan. Alright? So, in the sense, si marites talaga yung reliable sa tanan. Alright? Oy, malapit na tayo, okay? We have stomach and bowel contents. Stomach emptying, medium weight meal is in 3 hours. Delayed emptying can be due to a trauma to the brain or psychogenic pylorospasm. Remember that liquid is digested faster than semi-solid food, of course, as expected, no? Digested faster than solid food. All right? And remember this one, guys, no? Mushroom seems to stand up to gastric juices the longest. Pero may isa akong na-obserbahan. Ang pinaka, ano talaga, ang hindi talaga na pagkaon mo, amo man Japon, no? Ang mais, okay? Pagkaon mo mais, pagwa mais man Japon. Alright? So, pagka ano mo sa banyo, ay, sayang to, itanong ta. Alright? So, meal. Remember, milk, tea, coffee, in 15 to 20 minutes, nandun pa siya. Pag meat and veggies, 4 to 5 hours. Pag only rice, 7 to 8 hours. Bakit importante ito? For example, namatay ka. Okay, syempre sa autopsy, nakita natin, merong milk. So ibig sabihin bago lang siya namatay kasi nandun pa yung milk in 15 to 20 minutes, all right? So, pagkabukas na, nandito ang kutsara sang mang inasal. So, around 7 to 8 hours kasi nag-only rice ka pa to. Alright? So yun yung importante na stomach and bowel contents natin. Okay, we have postmortem biochemical changes. Pag pH decrease, then increase. Okay? Una, acid. And then, syempre, wala ka ng oxygen, no? Wala kang O2, increase yung CO2 natin. Of course, the pH is become, tawag dito, magiging alkaline. Okay? And of course, creatinine, kasi nga, hindi mo na destroy yung kidney mo, kidney functions mo. Alright? BUN, again, ganun din. Magnesium is decreased, potassium is decreased. So, tandaan nyo yung ano na yan, ha? Itong nakababa. While your enzyme, initially increase siya, and then pag naubos yung mga substrate natin, of course, magiging decrease siya. And glucose, usually examined using the right heart blood or the inferior vena cava. Increase siya initially kasi ginagamit pa nga, di ba, may glycolysis pa din tayo. Pag naubos na, eventually, bababa siya. So it is a useful sample for chronic arsenic poisoning and chronic drug abuse. Okay, the correct answer here is from the arsenic. Anong sagot dito? Arsenic is letter hair. Okay. Ano yung ik sinasabi ko man? Basta hair, buhok. Buhok, arsenic. Ganun ata. Alright? So ito guys, tandaan nyo lang ito. What I would like you to remember is yung hair. Hair kasi, hair-senic. Yun pala yun. Akala ko buhok, arsenic. Hair pala, hair-senic. Okay, chronic hair-senic poisoning and chronic drug abuse. So remember also this one, no? In fire deaths, arson investigation occasionally request specimens for accelerant analysis. Kasi yung mga accelerant natin, example yung mga gasolina, okay? Pag ginsunog mo ang bahay sa kapitbahay mo, pag na-check natin na meron kang accelerant or meron na-detect dyan na gasolina by chemical methods. So example, you are guilty na ikaw ang nagsunog. Alright? Or, syempre, pag nandun ka na sa loob, patay ka na kasi masunog ka. Okay? So pwede ikaw yung one of the suspects, no? Kasi meron kang accelerant doon. So importante yung lung natin in case of arson. Alright? And remember, pag meron tayong skin na na-inject poisonous sa skin natin, around 2 to 4 cm ang dapat nating i-size sa skin. Alright? So guys, yun yung end of part 1 natin. See you tomorrow sa part 2. Bilis-bilisin ko lang, pasensya na medyo matagal talaga ang lecture natin. Yun lang siguro. Thank you for attending, no? Medyo gabi na, iba natulog na. Okay, thank you. Good night everyone.